All right. Hey guys, we're looking up here. I'm in the beginning of the class stuff. I want to show you something about tutoring, and then I'm going to show you that there's actually 2 attempts for each of the quizzes. So let's get started on that. We'll just do a few minutes. So this is up here is the recent announcements and stuff, and we're going to go ding, ding, ding. Hopefully you can see the little cursor down there. Go all the way down to assignments, and then we're going to go to modules. Okay, so in modules, in yours, you're going to go down there. I have a bunch of junk that I have to see that I get to do, but we're going to go down here to Course Cafe. Course Cafe is kind of an information place where we can switch information. I tend not to use it, and it's because it's a real pain. It's just kind of announcements to everyone along with the announcements. So I'll try and double post this, but this is for tutoring. Now you have specific tutoring times. We open that up. We get a whole list, cafe discussion, how does it work, yada, yada, yada. And look, there's my old mug right there without a beard. And it says the whole list of tutoring. This is in addition to my videos, in addition to the other little things and the announcements and the hints and the other stuff that I send out. Notice there's sessions 1, 2, 3, 4, 5, 6, and all that kind of stuff. Different sessions for different weeks. In this one, we have here session 1. If you go to the link and you highlight this, right, zoom. Right there, for that time, Tuesday the 29th, you can probably get it to see the recording, and I'll post those as well if I can find them. I think I can find them. I should be able to. But we have these are here, so put those on your map or on your list so you can get those done. That's a good way to get the tutoring figured out. So go ahead and do that. Now let's look at something else. I'm going to go to... What is it? We need quizzes. Let's go down and find our quizzes. Here, there's quizzes down at the bottom. I'm going to click my quizzes. And for me, I get to see this a little different than you guys, but I'm going to show you what I get to see, okay? Quiz week 1. This was a doozy for some people. I mean, it's a lot of hard work. I do go over it a lot in different parts of the class, okay? So in different videos, I'll even give you answers for some of them because some of them will be a little tricky, okay? So for this one, let's go through it really, really quick. Week 1, edit. Now let's look down here. Quiz type, graded quiz, 100 points. Assignment is a quiz. Answer shuffles, so it doesn't shuffle the answers, which is good. Time limit, 20 minutes. Multiple attempts, yes. So it gives you at least 2 attempts, and it will take the highest score as your score. That's a good thing. I really hope that I have audio working on this thing, because if it doesn't, it's going to really be a bummer. Anyway, so let's go and look through this, okay, right? So you have questions, all this kind of stuff, due by, due November 4th. Okay, so we still have time to do that, because I'm posting this today. And this one here, let's go through and let's, let me preview. I want to see if we can do this kind of stuff. It's going to ask me some other things. I'm showing you the cheaty codes, right? So here we go. Here, after refer to the previous question on the first property. What? Refer to the previous question. Well, this is the first question. That's stupid, right? There's no previous question. Well, I'm going to say brushes his teeth because I'm assuming it's a dental thing. I don't know. That's very weird. It's not supposed to do that, but whatever it is, what it is. Let's go to the second. Which organ is located in the ventral on the vent side, the front, right? Located in the thoracic, but not in the mediastinum. Mediastinum is this area through here, right? Media, middle area where the heart and the big vessels are, and the esophagus and the trachea and stuff like that. That's going to be the lungs. Because the lungs are on the sides. Okay, the mediastinum is in the middle. The stomach is below the diaphragm, not in the thoracic cavity. The diaphragm is here. Everything above it is thoracic. Below it is abdominal. And so we have stomach right there. Heart is in the mediastinum, does not include that. And liver is on the right side. Or maybe left, I don't know which one you do. But on me, it's on the right side. On you, on the right side too. It depends on, remember, anatomical position, right? I was looking at myself, not at the screen. Here's the next one. Did we get this one? The lung is located in the thoracic cavity. Yes. What is the relationship of the lung to the head? Is it inferior? Is it deep to the head? No. Is it anterior? Well, my head's right back here, I suppose. Or is it superior? If I'm standing on my head, the lung is located inferior. Good. I'm just going to go through these real quick for you guys. Bacteria. Bacteria include cocci, bacilli, and curved rods. Are not part of the normal flora of the intestines. They are. Cause mycotic infections. No, myco means funguses. Okay, include mold and yeast. No, so include bacteria. So bacteria, right, which you do have normal bacteria in your nose, in your mouth, in your stomach. So that's why like a human bite is worse than a dog bite, because we have so much bacteria and it can mess with other people's systems. Dogs have different bacteria and they have different salivary enzymes and all this kind of stuff. Enzymes are what help break down proteins, or in our case, so we have amylase, which helps break down starches like potatoes. And there we go. Next on that one. Let's see. Bada bada bang, bada bang. Influenza. Influenza is a lung condition, right? As an localized infection. Allergic reaction? No. Allergic reaction would be like a sinus headache or something like that, or sniffles, or congestion, or rhinitis. Rhino means nose, and itis means inflammation. Bacterial infection? No. Systemic infection? What? Influenza. I'm going to say systemic, because it's not. You could have bacterial influenza. It's generally a virus, right? And it does affect the whole body because you feel achy and all that kind of cruddy stuff, right? It's localized would be like a cyst or something, right? It's like I cut my ear and I get an infection there. That's a localized infection. That's a hard one. So be careful of hard ones like that. There's tricky stuff in here, man. Which of the following lives in the intestinal tract and lays eggs in the perianal area, so around the anus, perianal, causing severe pruritus, which is itching. C. Tetani, that's tetanus. So you get a cut and you get lockjaw from that. It's really bad. You get a tetanus. You can look up tetanus, and it shows people like really arched back because all of those muscles tighten up in the process of that. Pinworms. Worms that are like pins. This makes sense, right? Typhi is for typhoid. Okay, typhoid fever, typhus, and C. Clostridium albicans. Albicans, that's a like thrush. Okay, stuff like that. So I'm going with pinworms because it's a worm. Now, the old days, what they would do, this is gross. The little kids playing in dirt get worms, and they lay eggs in the perianal area, and they itch and all this kind of stuff. And you just take a piece of Scotch tape and have your kids. You open up their pants in the middle of the night when they're asleep, and you look at their bum, and you go, "Oh wow, there's little worms." You put a piece of tape on there and tape them together, and then give them to the doctor. The doctor says, "Yep, that's what they are," and we give you some stuff like ivermectin. Actually, will help get rid of those. Same thing with garlic and onions can help get rid of those kind of things. And there's other medicines now like crazy. Other herbal things would be like black walnut, actually. Adipose, fat tissue. Dense fibrous, like the discs in the neck. Areolar, like the fluffier kind of stuff that's underneath the skin. And blood, okay, blood, that's the trick right there. And osseous, which is bone, are all connective tissue. Blood can be the scary one because you're like, what do you mean blood? Blood is a connective tissue. Remember, there's a solid portion of it, which is the blood cells, and then there's liquid, which is the plasma. Stratified epithelia. Stratified means stacked, right? Epithelia is the covering. So like skin is stratified epithelia. Glial cells means like glue. They hold things together, many of them inside the brain. Fat storing, that's adipose. So yes, it could be adipose, but we added all these other ones in there, right? 7 is 8. How many questions is this thing? 100 questions? Okay, whatever, 10 questions. Chondrocytes. Chondro means cartilage. Cyte means cell. So chondro, cartilage cells. And osteo means bone cells. Squamous epithelium. No, squamous means flat, right? Like one layer, or there's a simple squamous would be that. Transitional epithelium, that's like in the bladder, the urinary bladder, because it's box shaped, and then when the bladder fills up, they squish down, right? And then astrocytes, star shape, and epidermal cells are in the brain, right? We talk about those in neurology, but those are part of this. And then cartilage and bone, there we go. It tells us. So basically, this is a translation one, right? We're using one kind of word to explain another. We're saying cartilage cells, chondrocyte. Same thing, it's just direct translation. So those of you who've had or have English as a second language or English as a third language or whatever it is, it sometimes an advantage. So start kind of thinking that way. This is all about words, so it's really interesting. Let's do number 9. Which word refers to the flattened appearance of fish scales? Flattened, squashed, squamous. Glia, remember, glue. Stratified, striated means like striped. Okay, so like muscle fibers, when you look at it, they have stripes in them. That's called striated. And then stratified means stacked. So it's squamous. That's the way to do that. Let's see. This is exocrine. So endocrine inside, endo in, exo out, exit, go out. right? Exocrine, crine, when you see that word, it really means timing, but we're talking about hormones. So we're talking about glands, okay? An exocrine gland, salivary glands, sweat glands, is made of epithelial tissue. Yes. Secretes hormones. No. Is ductless. Secretes only sweat. An exocrine gland. We're going to go with, well, usually it's cuboidal or columnar. Secretes hormones? No. Is ductless? Means it doesn't have a duct. Yes and no, some of them. Secretes only sweat? No. So exocrine glands are much different. So I'm gonna stick with this one. Let's see what happens. Ooh. Ah, we missed. Wait, incorrect. So we missed the first one. I have no idea what refer to the previous question. What the hell's the previous question? We don't know what that is. Is that, I don't know. That's a dumb thing. So we got 90 out of 100. Okay, fine. I don't know what's the actual question. It doesn't. I mean, what's the answer? I don't understand that one. I'm going to look that up and see if I can fix it. But you do have 2 attempts. So go back and take it. You know, this is, I'm going to post this today or tomorrow. That doesn't help you, it does it, because the first time you're seeing it, if it's in 2029, you can say, oh, I'm posting it today. So who knows? But I'm posting it as soon as I can. Let's go from there. It has been, 11 minutes? That's too long. Anyway, you guys take care. Have fun on the weekend. The drawings do not have to be artistic. They can be stick drawings and block drawings or whatever, as long as I understand that you're doing it. I don't want to have you copy stuff and then just AI it or whatever, or just do stuff that's already been done. Please do your own work. Put it in your own words. When you have a reference and it's the same as everybody else's, I mean, that's cool because it's the stuff, but I want to see if you understand it. And by understanding, you put it in your own words. Anyways, this is Dr. Sean, and we'll see you again on the flip side or Sesame Street or wherever. Bye.